Good morning, everyone. Lois Frankel, Member of Congress here in Palm Beach County. I have with me State Senator Berman. I have from Planned Parenthood, Christina Noyce. Did I say that right? Noche, sorry. Christina Noche. And then we have a special guest with us, Penny Crosby, who has a story to tell us. Well, we have a story to tell you today. We're going to talk today a little bit about how the president's new executive order that he signed last week is going to affect the Floridians. We'll talk a little bit about the Florida law. Let's just start with this map. And as you can see, right now Florida, and I say right now, Florida remains really just about the only far southern state that's even allowing abortions, and they're banning them at 15 months. And let me put this in perspective. Last year, 80,000 abortions were performed in Florida. If, as the governor is threatening, Florida also bans all abortions, think about that. The potential of 80,000 forced pregnancies here in this state. So we are here to say this. The decision whether or not to complete a pregnancy really must be left to a woman and whoever else she wants to counsel with. And these new laws around this country, and you can see all these states where that is shaded brown, the decision of whether these personal decisions on people's health, their future, their reproductive care, is being left up to state politicians. So you're about to see that women in Florida are being walled in. They're being walled in. The executive order last week, which was signed by the president, which recognizes that it is up to a woman to make her own personal health decisions and should have access to legal abortion, will do the following. It'll protect women who want to cross state lines in order to access a legal abortion. And you can see that may happen all over the country. It will guarantee legal access to an abortion pill, but that is only up to 10 weeks of pregnancy. So that's going to help some women. The president also will use the forces of the federal government to protect healthcare providers and to help women learn where they can access legal abortions. Next week, the Congress will take up one of my bills, Women's Health Protection Act, and that bill, which I expect will pass, will prohibit any state from banning illegal abortions or putting unreasonable medical restrictions on them. We expect that bill to go to the Senate, and we're not sure what will happen over there, unfortunately. There is a web page now, and we will give you, for the media, there's a web page now where people can actually find out where they can access legal abortion and where they can get help if it's not being provided in their state. One last thing on the executive order, it protects women who need to get emergency medical care, even if they're past the 15 weeks, in order to save their lives. If they need emergency care, the federal government will protect them. But the fact of the matter is, folks, this is quite a dreadful situation for the women of this country and anybody who loves women in this country, or girls. A 14-year-old girl who's raped by her father and does not find out till she's in week 16. It would be illegal for her to get an abortion in this state. And that is horrific. So I have some other champions here. My final message is this. We are fighting back. We are fighting back because the right to make your own health care decisions, the right to be in charge of your future, your life should be up to women and not politicians. With that, I'm going to bring up State Senator Lori Berman.
Thank you. Thank you, Congresswoman, and thank you for organizing this event. I'm Lori Berman, State Senator for District 31, which is Central Palm Beach County. I've been on the front lines along with the Congresswoman fighting for reproductive rights and the right for women to have abortion in the state of Florida. Unfortunately, this past year, we passed a bill, HB 5, which would ban almost all abortions after 15 weeks. The bill has gone before a judge in Tallahassee, and the judge said that the law is blatantly unconstitutional. There has been a stay issued of the judge's opinion, so the 15-week abortion ban is the law right now in the state of Florida. But I want everyone to understand why the judge said that was unconstitutional. And he said it was unconstitutional because Florida is one of 4 states that has their own privacy provision in our Constitution. And under that privacy provision, which is much broader than anything in the federal Constitution, women should be allowed to have abortions. And I totally agree with the judge's decision. The judge's decision will now is now on appeal. I don't have faith in our Florida Supreme Court, just as our federal Supreme Court took extreme legal action to override a 50-year precedent. I am worried, very worried, that our Florida Supreme Court will do the same thing. And I am also extraordinarily worried about what will happen in the Florida legislature as we come up to the next session. The governor has been very quiet about the abortion issue because I believe he understands that most women in this state believe that they should have access to reproductive health care, that it is medical care, and that they should be able to have abortions. But I don't doubt that once the election is over, if we have the same governor, that there will be an attempt to even limit abortions and put us into one of these brown states, unfortunately. So we need to act now. We need to get the word out that Florida does not belong in these brown states, that the 15-week abortion ban is unconstitutional, and that we should go back in Florida to the Roe viability standard. I have a bill that I'm bringing in the legislature again this year to codify Roe in the state of Florida. I brought it last year. Unfortunately, we didn't get any activity on it, but we're going to continue to move forward because we need to make sure that we protect women's rights to abortion and health care. And we've seen that these new efforts are draconian and will be very dangerous for women. People will still have abortions. It's just a question of keeping them safe and legal. So I'm so happy to be joined here with my colleagues, and we'll pass it on to the next speaker.
Hi, I'm Christina Noche. I am the Communications Director for Planned Parenthood of Southeast and North Florida. We operate 10 health centers across South Florida, the Treasure Coast, as well as Gainesville, Jacksonville, and Tallahassee. We provide care to 45,000 patients a year, including family planning, so that's birth control, STI testing and treatment, cancer screenings, as well as transgender services and abortion care. I wanted to tell you a little bit about how the overturning of Roe and the 15-week ban is affecting our patients and what we've been seeing in our health centers. This is a dangerous and scary time for women, but also for the doctors who are trying to provide care and do what's best for their patients. Our health centers are extremely busy. We are working around the clock, late hours, weekends. We have double the patient volume that we did originally. Last week alone, we had 40 patients that were from out of state. They're coming to us from Alabama, Louisiana, Tennessee, Texas, for abortion care. So we're trying to help Floridians in our own communities, but also provide care for this influx of patients coming to us from out of state. Right now, there is an abortion desert across the South. There are no appointments, there are no providers, so they are all coming to Florida for care. So we're doing a few things to deal with this. So we are expanding our hours. I mentioned we're also expanding the days we're providing abortion care. We're also working on the weekends to get as many patients in as possible. We're also hiring more doctors. We are onboarding about 9 doctors right now, many of which are coming from other states that have the harshest abortion restrictions. They can't help people in their own state, so they've said they would come here and get on a plane several times a month to Florida to help us. We're also trying to see as many patients as possible before they approach the 15-week gestational period, because now there's a ban after 15 weeks. So any woman that is around that time period, we're trying to get them in before 15 weeks. We're also expanding our patient navigator program. This is a program where we answer questions patients have, try to find them appointments, and we also cover some of the cost of transportation and hotel stays. If you remember a few months ago, we have a 24-hour mandatory delay, so any woman that now needs an abortion has to be seen at least 2 times. So if you are coming from a few hours away in Florida or out of state, you have to stay several days in a hotel now to access care. I was just talking to one of our physicians this morning, and prior to the 15-week ban going into effect, in 1 week, we had 3 patients from 3 different cities, one of which Florida, who were sent to us because they got an anatomy scan past 15 weeks. They had a very wanted pregnancy, but they found out they had a severe fatal condition. Now, with the 15-week ban, we would not be able to help these women and these couples who are just trying to make these decisions for themselves. We would have to send them out of state, the closest, which would be North Carolina, if they even have an appointment. We also saw a young woman, a teen, who was a survivor of rape and human trafficking. She was very worried that she would not be able to get an abortion past the 15 weeks and would be forced to stay pregnant and give birth, and we were able to help her. And just the other day, we had a few women from Texas who didn't even have an appointment. They just jumped on a plane and walked into our health center hoping to be seen. And our health center staff are amazing. They have not left until every patient in the waiting room has been seen. So the bottom line is, our patients are very clear. They do not want politicians inserting themselves into these personal medical decisions, and they have no place in the exam room. Planned Parenthood is here if you need an abortion. It is still safe and legal in Florida. You can contact us. You can also go to abortionfinder.org. We will help you, and we will help you find the care that you need.
Introduce yourself and how you start. Okay.
Hi, good morning. My name is Penny. And at the age of 16 and a half, I found myself faced with a very unexpected and a very unwanted pregnancy. I was in a small town in Tennessee. My parents gave me a choice. They gave me actually several choices. And I chose to terminate my pregnancy. We had to travel 3 hours away to go to the nearest Planned Parenthood. It was not an easy decision, but it certainly was the right decision for me. I was going to college the next year. I did not want to get married, and I was certainly not ready for a baby. So I remain extremely grateful that I had that choice. I have no regrets, as hard as it was. So I am grateful that I had the choice. Thank you.
Thank you. All right. Well, thank you, everybody. Look, here's the thing. Things are hard enough for families today. We know that. Ask any family. And this new Supreme Court decision has put a much heavier burden and taken personal decisions about your own health care, your future, your life, and now giving it to state politicians who really, they don't really care, and they don't really know. And they don't know the circumstances of each family and of each woman. So, today's message is this. Abortions are still legal to some extent here in Florida. If you are pregnant, you don't know what to do, you want to terminate your pregnancy, you're not sure, you should contact Planned Parenthood or someone you trust. There are ways, there are people trying to, if you're past 15 weeks, there are people who are now operating to try to get people to states where it's legal. And again, the president, with his executive order, makes it safe to travel, makes it safe to get the abortion pill up to 10 weeks in pregnancy, is going to make sure that contraception is available throughout this country. I'm going to protect healthcare providers, protect their safety. But this is a fight and this is a struggle, and everyone needs to understand what's about to happen in this state, especially if abortion is banned. We'll take any questions. Yeah. Yes.
Spurred on, is there a possibility that Roe v. Wade will be reinstated, or is it just that the way it is?
Okay. In terms of Roe v. Wade, the Supreme Court has said it is up to each state to decide for itself whether or not to permit abortion. That's basically what the law is in this country now. So as you can see, just from this map, is every state's on their own doing something different. We expect that very shortly, half the states in the country will not permit any form of abortion, and others are going to restrict it. That's the law of the country right now. We are trying in the Congress, we will pass in the House this week the Women's Health Protection Act, which would basically say the states can't do that. You can't have unreasonable medical restrictions prohibiting abortion. However, that bill has to be passed in the Senate, and that is not likely. So we're still back, we're going to be back state by state. The president has an executive order, which is law, but that only goes so far in its protections. It will protect interstate travel. It'll protect the delivery of abortion pills, which will only be good up to 10 weeks of pregnancy. It'll protect access to contraception. It will provide lots of information for people who are looking where they can get an abortion. It will try to protect providers and patients to be safe. And that's the state of the law. It's pretty scary here in Florida, and everyone needs to pay attention. Yeah. For who?
For each of you there.
Okay.
Both of you. If you were to come from Senator Rubio or Scott, when is last you heard from them about this bill and what it said? And for Senator Berman, if I can ask a question after you answer.
Yeah, do you want to answer that? No. As far as I know, is Rubio and Scott are for banning abortion. I never, right? I will say this: with elections coming up, as many politicians are trying to, who are in general elections, are trying to be quiet right now, because overwhelming number of people in Florida and in this country believe that abortion should be legal. Yeah.
Have you heard from introducing the bill with the construction? Also, have you heard from any public colleagues in Palm Beach County, whether in the House or the state Senate, if they would support or oppose or anything?
I have not heard. We did introduce this bill last year. We had the same exact bill codifying Roe last year. I had a House sponsor who's no longer in the House. He's resigned to run for Congress. But last year, none of them supported it, and I truly believe that none of my Republican colleagues will support the bill at this time either. I'd like to see that we do have some moderate Republicans, but unfortunately right now I don't feel that there are any Republicans in the Florida House who will support this legislation.
Yeah, and I think it's important to recognize, and this is what I really see sort of as almost a rebound, is because we have so many patients are going to be coming into this state for abortion, which means really a burden. I mean, it's not only going to be difficult for women here to get abortions, the burden on our healthcare system is going to be phenomenal, really. Not in a good way phenomenal. And so, our healthcare providers are doing Herculean jobs right now just to even take care of the patients. I am very, very worried that Florida will try to prohibit people from crossing state lines. That's why the executive order is very, very important. Or that Florida is going to ban abortions altogether. So that's why it's important for us to keep an eye on what this legislature is going to do. Yeah. Planned Parenthood.
The 2-visit requirement, is that just for Florida?
There are several states that have a 24-hour mandatory delay. We're just happen to be one of them. So you would have to have 2 appointments 24 hours apart. So in the past, you could come from out of state, and even if you traveled 10 hours, you could get the procedure and leave. But now you have to have 2 appointments. So you'd have to stay several days to get the procedure and then go back. So it's just putting an additional burden on patients and on the health centers because now you have to see the patient, each patient twice.
Was that implemented July 1st?
I believe that was April.
April.
And that's a burden for the women here too, because having to take off, find babysitters, whatever, leave your job to do 2 appointments that are unnecessary. I mean, it's becoming more and more burdensome.